Very often, especially the younger you are, if you get this diagnosis, it feels really overwhelming.
Now, I can speak from experience. I know that pregnancy, especially your first pregnancy, can be a time that's really overwhelming.
I think it related my egg count to someone that was like 41 or 42. That's all I saw. So I'm like, my mom went into menopause in her mid-40s. I'm like, I gotta hurry. I'm like, what? A lot of urgency, kind of like, it really alarmed me. And then when I sat down with you, I remember it was virtually at first, you gave the whole concept of the vault. And that is when it all really came together in my head, and it gave me a little bit of peace. I'm like, okay. It really clicked for me when we talked about family size. And that's when I felt validated to move forward with treatment. Even though we weren't at that year marker, I was like, well, we want multiple kids. Right. I don't know what the future holds.
Welcome back to the As a Woman podcast. I'm Dr. Natalie Crawford, and today I'm joined by someone incredibly special to me, my former patient and friend, Stefany Bare. She is bravely sharing her fertility journey. She was young, healthy, and proactive when she started trying to conceive, but early testing revealed something that she didn't really expect: low ovarian reserve. Her story is a powerful reminder that fertility doesn't always follow the rules, and that listening to your intuition can make all the difference. In this episode, we're going to be talking about why early testing can matter, especially if you suspect that something isn't right, what it feels like to get an unexpected diagnosis during your fertility journey, and how Steph navigated trying again for her second child with a different mindset and a deeper understanding of her body. So whether you're trying to conceive or simply want to feel seen in your own fertility story, this conversation will leave you feeling informed, empowered, and less alone. Steph, thank you so much for being here today.
Thank you. I can't believe I haven't seen you since I've been your patient.
I know.
And it's just cool to see all the life we've lived, and it's just really exciting to talk to you today. So thank you for having me. It's an honor, truly.
Oh, well, thank you for being here, and it's been fun, like following you along on Instagram and seeing, the ups and downs. And I still remember when you sent me a DM, like, I'm surprised pregnant with my second, and how exciting that was.
I think you found out like before half my family, honestly.
I was like, I'm so thrilled. You were like, you will not believe it.
Yep.
Well, I think it's really important. Well, one, I got to say thank you for sharing your story.
Yeah.
It's, vulnerable. I think you've probably learned by sharing it publicly too, that it really helps open doors and conversations, because so many people suffer in silence and they feel really isolated when they have infertility.
Yep.
So I just want to say a big thanks for even coming on here, but just publicly, even on your platforms, for talking about it, because it does matter to so many people.
Absolutely.
All right. So one thing that I think is really important to start with in your journey is that you came to see me and you got testing done much earlier than what the traditional definition of infertility is. So typically we recommend that people try for at least a year when they're under age 35 before they get diagnosed with infertility or come into the fertility doctor. But I saw you after about 6 months of testing.
Yep.
Tell me what led to that.
Yeah. So my husband and I were a COVID couple. We got married in the middle of COVID. So we got delayed quite a bit. I got married at the age of 28. And we didn't want to wait a long time to have kids. And we knew we wanted a larger family size, which we'll talk about that later. Once you have kids, it changes for sure. But we knew we wanted multiple children. So we didn't really want to waste any time after we got married. And we already had some delays through the pandemic. So it was, I think, we got married October 2020, and we kind of just stopped preventing, like a lot of couples do. Once you get married, whenever it happens, it happens. Was very chill about it. And then once it kind of hit January, the new year, after like 3-4 months of trying, I was like, okay, I'm going to actually educate myself, which is actually when I found all of your social channels. I'm going to learn how to track ovulation. I'm going to get all the little sticks. I'm going to get the apps. And I took it a little bit more seriously. So we did that starting in January. And then May came around the 6-month mark, where I was like, nothing is happening. Yeah. And I have normal cycles. I'm so confused. I think I'm doing this all right. So I think so the first step that I took was actually going to my OB. And again, she said, come back in a year, which I understood. But at that point, I wasn't informed and educated enough on what to ask for, the testing that was available. So we kind of just missed each other, and I just kind of left that appointment feeling a little disappointed and confused. So I ordered an at-home fertility test, and that is when it came back. And everything was green and normal except my AMH, which at that time, I had no idea what that was. Never even heard those 3 letters together in my entire life. And from there, I was like, okay, I think from what I'm reading from this test, I think I have a gut feeling that I think this might not impact my ability to get pregnant. That was my understanding, but I think it's going to shorten my timeline. And we want multiple kids, and I'm almost 30, so I'm going to get some help. And at the time, I was following you really closely because I was very on the fence about getting the vaccine when I was pregnant or trying.
Yeah,
and you
whole
were
thing.
Yes, and you were an amazing resource just for educating me on that. And I felt so confident. And then I found out that you were in Austin. And this was 6 months into trying, and I'm like, I had no idea that we were in the same city. I'm like, she for sure has a wait list that's got to be so long, but I'm going to try to get in with her. I got in with you guys right away. And yeah, I think it just goes back to a gut feeling. 6 months in, I was just like, we are both healthy.
You are.
And we are young. And everything seems to be normal except that one little factor. I want to learn more about it. And yeah, it was just a gut feeling when it came down to it. And I'm really glad that I did.
And for people who don't know you, I mean, you and Nick are very healthy.
Yeah.
I mean, is to simplify what he does. I mean,
Yeah.
he's literally a health influencer
Yes.
in a lot of
Yes.
ways, right?
Yeah.
So you're very young, you're very healthy.
In tune with our bodies.
Yeah, very active. So being able to say like something wasn't right isn't just kind of ignoring it. It's actually being so insightful.
Yep.
And studies support that. So over 70% of couples in your age range would be pregnant within 6 months. So the fact that you weren't is falling off the curve. It's one of the reasons I think it's a little crazy that this recommendation exists to wait a year before you start fertility testing.
Yeah.
I always say the fertility industry is so reactive. Like, I really wish that it was a more proactive stance.
Yeah.
I wish your doctor would have said, oh, you want kids or you're trying. Let's order that AMH test themselves instead of making you essentially do your own research and be like, what can I do? Let me get a mail order test.
Yep.
For people who don't know, AMH, and I know you already know this because we've talked about it, it's a measure of what we call your ovarian reserve, or how many eggs you have remaining. It's really important for people to know that this test is just a one-time glimpse. It changes month to month.
Yep.
But I think one of the key things is having a low value can be a red flag that something else is going on, but it is not an end-all be-all. Although very often, especially the younger you are, if you get this diagnosis, it feels really overwhelming. How did you feel? I can only imagine it was worse because it came like in a PDF report or something too.
Yeah, the PDF report, I remember, said something like I think it related my egg count to someone that was like 41 or 42. That's all I saw. So I'm like, my mom went into menopause in her mid-40s. I'm like, I gotta hurry. I'm like, what? A lot of urgency, kind of like, it really alarmed me. And then when I sat down with you, I remember it was virtually at first, you gave the whole concept of the vault. And that is when it all really came together in my head, and it gave me a little bit of peace. I'm like, okay. So my egg, I don't have no eggs. I have eggs left. My number was low, but it wasn't like end all be all, right?
Nope.
So I think what gave me peace to start the whole process was just talking to you and you sitting down and actually taking time to talk to me and teach me what it is and explore the options. And I think it really clicked for me when we talked about family size. And that's when I felt validated to move forward with treatment. Even though we weren't at that year marker, I was like, well, we want multiple kids.
Right.
I don't know what the future holds. So a lot of peace came with information.
I've seen a change of this in my field, and something I've always been very passionate advocating for is this concept of what is your goal? And I know that, of course, it's like, I want to have a baby, but really taking a moment to step back and think big picture. And as you alluded to, which we'll get to, goals can change.
Yep.
But it's important to think about, if life is perfect or how do you envision it, what makes the most sense for you? Because if you do want multiple children and you're struggling to get pregnant with that first, what is going on? Is that impacting your long-term goal? But you'd be shocked to see how many fertility doctors never bring that up. Or patients aren't informed enough to bring it up themselves. And you get so focused on one child, and there may have been choices they would have made. Maybe they would have accelerated treatment or done something different that could have kept future children as a game plan as well.
Yep. It wasn't just for, at that point, my first. It was for the ones to come after that.
Did you tell anybody when you were in this part of the journey that you had low ovarian reserve, that you guys were trying to get pregnant, you were having infertility? Was this something that you and Nick just kept together, or did you share this with other people?
Yeah, it was interesting. Of course, our close circle knew about it, like my mom and my sister and some close friends. But when we have social media platforms, and it is weird when it was so all-consuming for a year of our life, but it just felt like something that we didn't really want to share real time. So yeah, I mean, I remember even talking to my mom and my sister, and they're like, "We have no idea what AMH is." Like, information is so awesome that we have it, but at times it can be a little bit, anxiety inducing, and you have all these numbers thrown at you. But yeah, it is something that's really hard to deal with in silence. But I think having a couple people that knew about it is what really got me through it.
I love that you didn't just tell nobody. When I went through infertility, I didn't tell anybody.
Yeah.
And of course, I'm older, so it's a little bit different time.
Yeah.
But it was just my husband and I. And I always think, looking back in hindsight, I didn't give those people in my life the opportunity to support me that I really could have used when we had pregnancy loss or we were struggling.
Yep.
And so I'm glad that you told your close circle of friends. And that's what I always recommend to people. Like, maybe don't go tell the whole world unless you feel comfortable, because some people are sharing their stories in real time, which is incredible.
Yeah.
But at some point, at least tell your people who are close to you so that they can be there to support you. Because the testing can be confusing. It's not always the easiest pathway.
Yep.
You're making decisions that feel like there's a lot of pressure on them. Even if I say, well, there's no right or wrong choice, it feels like there's a lot of pressure on each choice you make.
Yeah.
When you were kind of going through this, and I know you guys shared your story when you were on the other side of it, what was the response to that from the public?
So many people raising their hands saying, me too, or I thought I was the only one, which that makes it all worth it. Absolutely. A lot of people always ask me, like, what's your advice for going, through this season that I'm in if someone's in the same boat? And I always say, I don't really have advice for you. I just want you to know that you're not alone. And sometimes that's all you need. Sometimes I didn't want all of this heavy advice because
that's so important. You get so much.
Yeah. And chances are you've probably tried everything, at that point, if you are seeking fertility treatments. So I think, just letting people know that they're not alone. And I think that was the biggest thing. Sometimes that's all you really need.
When it came to ordering a fertility test online, right, to check your ovarian reserve, I have a love-hate relationship with direct-to-consumer testing. On the pro, I think overall they're good because it's getting more information in people's hands. And maybe if the medical system was set up to give that to people more proactively, they wouldn't need to do that.
Yep.
But I do think it's really hard to try to source that information yourself and then to be on the receiving end of it.
Yeah.
Do you have any advice for people if they are trying to maybe get information on their own? Maybe there's not a fertility doctor close to them or their OB is not super receptive about what they should do when they get that information or how to handle it or mentally process it. Yeah.
So when I got I guess it was like a mail-in blood work, for me, that felt like the next step after going to my OB. I was like, I don't want to go into a fertility clinic and be like, I don't really know if anything is off or broken. But so that was just a really good foundation for me. And that was like the basis of my knowledge and education. And the one that I used really did have really great educational resources that went along with it. So that's always something that I've kind of pointed my friends towards that don't have access to an in-person clinic or don't want to go to that step yet. That gave me a lot of empowerment to be like, okay, here, I have proof. And then that gave me the confidence to go in and really advocate for myself. And I feel like I knew the questions to ask. I knew the topics that I wanted to hit. So I do think it's a great resource and a great first step if you don't have that access to someone, down the road.
I think that's great. I always think the next step is to go get an appointment. And I think a lot of people think they have to have a reason to come see a fertility doctor, meaning I have to have been trying X amount of time or I have to have this problem. And the truth is you can come to a fertility doctor, you can get testing at any time. You can always get it, even though you don't meet the criteria for infertility. And there are circumstances where you should go get seen earlier. And specifically if your periods are irregular, if you're having difficulty with intercourse, or if you have any known tests that come back abnormal. So yours was a low ovarian reserve test, but other people, maybe they're listening, they have endometriosis or they have PCOS. You don't need to feel like you have to wait. There's this weird dynamic I see in patients sometimes feeling like, I don't want them to think I'm crazy for being seen so early. I don't want to be seen as this type of patient. When in reality, we're proud of you for advocating for yourself. You're never wrong to get more information and to get more data. When it comes to ovarian reserve, I know I talk about it all the time, but I'd love for you to talk about what do you understand about it now, being on this side of things?
Yeah, okay, well, again, your explanation of the vault completely was the perfect visual, and I've used that talking to friends so much. But yeah, I think when you see that red flag on the test, I was like, oh no, and then it says egg count. I'm like, that's the worst result to have something an off number in. But I think initially, like I told you before, I thought, oh, well, urgency. Like I need to think about how many kids we want. I need to plan this all out. Does this impact my ability to get pregnant? Is this why I'm not getting pregnant? I had so many questions. But when you really talked about the vault and how you're born with the eggs and you can't get any more, right? That number is only going to go down. It did, kind of confirm my urgency that I was feeling, but it led Nick and I to have some really serious, great conversations about what we want our future to look like, which if I didn't have access to that number, I don't think we ever would have had those conversations. So that was huge. But it gave me a lot of peace when you kind of explained to me that this doesn't mean you can't get pregnant. We just have to talk about timeline. We have to think a little bit more in the future. And there's so many options for you for future kids. It gave, the common word here I feel like is peace. Like you just gave me so much peace. But that's what education and information does. And that's what all of your platforms are. So yeah, AMH, having a low AMH, I get a lot of DMs being like, my AMH is this. What was your number? And I'm like, don't panic. Yeah. There are options. Just find the right person to help you and listen to you, and you can go from there.
So important, right? It's not an end all. We have women with extremely low AMHs, literally that show up 0, that still have eggs and still are able to have a child and to have response to treatment. I always say, what this is telling you is that you need to do something now. Doing something is getting data, having an appointment, having conversations, making decisions. Yeah. So by default of seeing somebody doing the test, you're doing those things. Yeah. It doesn't need to be a panic mode, although I think it's so normal because suddenly this thing that we've always envisioned, I'm going to be a mom, I'm going to have X number of children, it feels threatened. And you start looking at life as maybe this isn't going to happen for me. And I think there's not enough talk always about that emotional side of the journey, how it might change your self-perception of what you want your future to be.
Absolutely.
And how that can feel. When you get a low test, I think we'll tell everybody, the next step is you'll get an appointment. We will talk a lot. And then there's other testing for all the other aspects of fertility, right? Because I always say if we need to accelerate the process, we need to know everything that's happening. So evaluating anatomy, evaluating semen analysis, bigger blood work panel, and then talking based on those results about a game plan to try to accelerate treatment. You and Nick went on and you got pregnant with IUI for Charlie, right?
Yep.
What was that process like? Was that what you expected? Was that hard, easy?
Looking back, it seemed easy compared to a lot of my friends and what they go through with IVF and other challenges they have in that world. But in the moment, any type of fertility treatment and procedure to get pregnant seems scary and like, I can't believe this is actually happening to me. But the process as a whole, I was actually going back and thank goodness I took notes and wrote everything down. I was looking back last night because you forget.
Yeah.
It's 3 years ago. I guess 4 years ago, kind of. You forget. And I was like, I forgot all of the things that we did. But one thing that was so true about my entire journey was I knew everything that we did from, I think we did a medicated IUI cycle. So we were in checking the follicles. I was on Clomid. We did progesterone. I was on birth control for a little bit. There was so much being thrown at me, but I always knew why, the why behind it. And that was super important to me to know, why am I taking this? What's this going to do to my body? What part of the process is this? So I felt really good because I was seeing you so much and we were just getting green lights and we were super lucky with that. And it's kind of exciting too because you're trying something, a new method for the first time. And I really appreciated how honest you were with me about the likelihood of it working. I think you said isn't it like 10%? Yeah. So that was super important too because I think a lot of people can go into treatments thinking this is going to be it, it's going to work, but that kind of humbly brings you back to earth, and it gave us good perspective and expectation going into it. So we fully did not, we expected it to not work. And we were already having conversations about IVF just because of my low AMH to get those embryos in the bank. So we were, the night before we found out we were pregnant, we were planning IVF because I just was like, there's no way.
I remember us talking and we were just like, let's just try IUI, right? That let's just give it a chance, kind of going from nothing to IVF felt like a lot. But I remember us talking about success rates and you not wanting to do a lot of cycles, which is good. I always say at some point you don't want to emotionally, physically exhaust yourself before you go into something with higher success rates. But, based on how all your results came back, I was like, this is worth a try and just see how it goes and see how you feel and see how you respond. What advice would you give? I think you already kind of mentioned it probably, or I'm going to guess what you would say. But if somebody reaches out or a friend in your life says, hey, we're starting fertility treatments, what is the best piece of advice you might give them specifically when it comes to advocating for themselves in treatment?
So if someone's going through fertility treatments, I would say the biggest thing is to keep protection over your mind and your heart. Because for me, and we'll get to my second pregnancy and how different that was, or my second time trying to conceive, but I really feel like I let the stress and the control, I had a white knuckle grip over this process. And if I learned anything, that's what doctors are for. That is what, it's just something that's out of your hands. So I feel like I did let my joy and my peace get a little bit taken from me during that time, because I was just so trying to control everything, when it's just one of those things in life you just cannot control. So I think my only piece of advice would be to try to protect your peace and try to protect your joy. I know for me, sometimes that meant like unfollowing people on social media with the perfect family that I wanted, and it was nothing against them, but I was just trying to protect my heart, because I knew what I was about to go through was going to be tough. So I just really wanted to have a clear, joy-filled, positive mindset. So it's just, protecting that peace and just being hopeful, but proactive and ready to pivot, because I feel like that happens a lot.
You may not know that the number one reason why people stop fertility treatments who ultimately could have success is emotional distress. So it's not, oh, this is physically hard, or I got too old, or I ran out of money.
Wow.
It's the emotional impact of the journey. So I think that advice to say, really think about yourself and put some time saying, who am I? What makes me feel good? What makes me feel bad? And let's prioritize my own self-care a little bit during this time. And if that means unfollowing or restricting or muting or, maybe separating yourself a little from somebody who's causing more stress in one way or another.
Absolutely.
You have permission to do that.
Yeah. I remember I had a girlfriend who was going through something very similar a year after me, and she got invited to a baby shower, and she's like, I just don't know if I'm in a place to go. And I'm like, don't go. I'm like, if it's going to put you in a dark spiral, protect your peace. She was going through IVF at the time. I'm like, you need to be in a good spot mentally. Don't go. And she's like, thank you for giving me permission to not go, because I just don't think I could handle it. As guilty as that made her feel, she was doing something for herself to protect her mental health, which, like you just said, it's a big piece of the puzzle.
Right. We should feel comfortable protecting ourselves, but we always fill our day with things we should do for other people. And I think when you're going through infertility, it's really important to really prioritize your own health in a lot of different ways when it comes to how you care for yourself emotionally and also physically. I want to say the other thing I recommend that you said too is this feels like a very out of control process. So control what you can. But a lot of that is, who are you seeing? Knowing why you're doing what you're doing. Doctors have different styles. Patients need different things. There's no one right way. But if you are a controlling person like I am when I'm a patient, what are we testing? Why are we doing this? What are we looking for? What is good? What is bad? Knowing the expectations, kind of knowing the outcome really gave me peace personally along the way. Absolutely. And so if your doctor maybe isn't forthcoming with that, it doesn't mean they won't be, but you might have to take control and advocate a little bit more. So you can say, okay, well, Clomid, what's that going to do? Or what are we looking for on this ultrasound? I never fault a patient if I walk into monitoring and she says, what are we looking for today? I'm like, you should know that. You should know what the goals are for the day. If I haven't done a good job in telling you what they are, ask so that your doctor can tell you what we're looking for. So then you can have your expectations kind of appropriate to know, is this right? Does this not look good? And what are we going to do in those scenarios?
Yeah, and I will say too, Fora was the first place that I didn't feel rushed.
I love that.
And that is so important, because you are seeing so many patients a day. You have so many stories going through your head and numbers I can't imagine, but I forgot about that when I talked to you and everyone on your team. And that's what made me feel like, okay, this is the right place for sure, because I feel like when I'm here, they're not trying to move on to the next one. They're informing me, and I knew what the next step was when I walked out the door every single appointment. And I just wish that everyone had that,
But you can always get another opinion.
Absolutely.
If you're not feeling like the place that you are seeing, no matter what aspect of healthcare we're in, you can always go see somebody else. You can always get another opinion.
Absolutely.
A couple of questions. When you were going through IUI cycle, trying to get pregnant with Charlie, obviously trying to control what you can, you and Nick were already really healthy. Did you change anything in your life otherwise? Did you change any lifestyle factors? Did you modify how you were exercising or eating or sleeping, or not really?
At that point, because I didn't have children, I was sleeping great. So there was no room for correction there. I think, I'm sure, it's hard to remember, but I'm sure I researched all of the diets, fertility and all of that. And I remember making those small changes. And I remember we really took out alcohol during that time too. I'm like, I'm just gonna, like, what's the point, you know?
Yeah.
So we
make it easier for you.
Yeah, absolutely. But I remember, like, Nick, what he really tried to do was just, like, get us out to have fun and take our mind off of it. And that did more.
That's so Nick.
Yeah, right? And that did more for me than any thing I tried to cut out of my diet. That was super important. But yeah, with a healthy background, I was like, okay, I think I have a good foundation for this. But of course, you always want to make the little tweaks that you can. But information can be really overwhelming, and you can read something and then something else that contradicts it.
Well, that's all you'll find online is two things that say the exact opposite piece of advice.
Yeah.
I think a lot of it is listening to yourself. We all know our body the best, and you already came in really quite healthy. But if people are not, thinking about what makes you feel good and what makes you feel bad, I think we all can agree. Alcohol is an easy example. Like, you don't feel great after you drink. That's your body telling you what reaction it's having in your body. And so when you can't control the outcome of every piece of the treatment journey, you can control, your peace, your own lifestyle, and know that you're kind of bringing to the table kind of a good starting foundation.
Absolutely.
Tell us about getting pregnant with Nico.
Yeah, so Nico is my second. He's turning 1 in August.
Oh, I can't believe it.
I know. Well, I can't believe it either. So we had the conversation for baby number 2 right after Charlie turned 1, and I wasn't really on board for 2 under 2. I'm like, let's just chill a little bit, and I'm like, I just had the idea that it would probably take longer because that was the only experience that I had, right? So right around when she turned 1, we were like, okay, let's kind of do what we did. Let's not be so careful. And she was there 25 months apart. So yeah, long story short, the first month that we did not prevent, we got pregnant with Nico. And we were in New York on like a fun trip, eating sushi, drinking alcohol,
being normal.
Yes. And I remember just being like, this is a familiar feeling. And Nick's like, there's no way. I'm like, you're right, there's no way. I was already in my head planning to see you again, because that's all I knew.
I think you had texted being like, we're going to try for the second soon.
Yep. And I already was like, I really want to see where my AMH is at, and I just want to make sure we're going the right path. And then we're in New York, and I'm in a CVS in Manhattan, and I take a test, and it was positive. And we were absolutely shook. My entire family was absolutely shook in the best way. Like, what a blessing. I couldn't believe it. Believe it. But a part of me just can't help but think that because I was just so at peace and chiller about it, and I didn't have a lot of stress in my life about that, I wasn't so white-knuckling, the topic of getting pregnant, I can't help but think, was my body and mind just in a better place?
And you were a lot more educated. You were kind of prepared for what that journey may look like, which does give you peace, right? Even if you mentally say, okay, well, I know this, so this is probably what it's going to be.
Yeah.
The unknown is the scariest thing.
Yeah.
Right? So kind of feeling like you knew what the path would look like probably did relieve your stress to some degree.
Yep.
And I always think it's a little bit different trying for your first and trying for your second.
Yeah.
Right? Like there's this really... Of course, your whole family is really important, but there's this big fear when you are struggling to get pregnant with your first that you may never be able to achieve this thing called motherhood.
Absolutely.
Right? And I think once you have one child, your perspective on what the journey looks like, none of it feels as scary, hopefully.
Yeah.
What advice do you give to people who maybe are in one of these positions, or they're scared to get evaluated, or they're listening and they have some gut feeling that maybe something's not right? What advice do you have to give to somebody who's listening to
I think it just comes down to information is power. I can't believe how much I grew in my confidence and just as a person, just from understanding my body and what it does. I mean, that whole year, I was just like, I cannot believe we aren't taught this.
I know.
I can't believe we aren't taught this, and how I can be talking to someone and they still think that they can get pregnant every day of the month. I'm like, as women, we need to know this. So I think that just comes down to it. Social media is an amazing resource when it comes to education. It can be overwhelming, and you have to really, think about who you're following and do your research. But for me, that's where it all started. And I mean, I've been told, I remember with Nico's pregnancy, someone asked me, are you in the medical field? You just know so much.
Oh, I love that.
And I'm like, I am the furthest thing from the medical field, but I've had really good doctors and people around me to educate me and empower me and allow me to advocate for myself and be confident enough to use my voice and ask questions, because I can't tell you how many times I've been to a doctor where they say a bunch of things that I don't understand or can't pronounce, and I get home and I'm Googling, and then it's worse, and then you spiral, and I'm texting friends being like, did this happen to you? But it doesn't really matter because we're different. But just having the confidence to ask questions in real time, which it seems so simple, but it's not when you're going through something hard. That's the biggest thing that I can say, is just inform yourself and use your voice.
This is such a bad correlation, but it's almost like if you get your nails done and you know you're hating it in the process.
Okay, that I still do.
But you don't want to speak up and you don't want to say anything about it because there's this internal narrative about how you will be perceived or what it will look like.
The water's too hot. You're like, no, it's good.
You just suffer through. And,
Yes,
you know, maybe we're okay with that at the nail salon, but it absolutely should not be that way with your doctor's appointments, especially with something as important as your fertility, as your body.
Yeah.
You know, people shouldn't have to think you're a doctor or in the medical field just because you actually understand how your body works.
Yeah.
That should be baseline knowledge that we
tells
all
you
have.
everything. Yep.
That we don't have, but we should. And so I think that, you know, that's really highlighting the point, like, give yourself that permission to ask the question and not to feel afraid. And I always say, you know, write them down ahead of time. It can feel really overwhelming in the moment, especially that first fertility visit. I don't know if you remember, it's like 60 minutes often. It's so much education coming at you, talking about ovulation, ovarian reserve, testing, odds of success. Yeah. And a lot of people feel so overwhelmed with that. But I remember you were like at your desk, you took notes, you had a list of questions.
Yep.
You know, you came in from a place of, I'm really going to take this and I'm going to learn.
Yep.
And you've shared that with other people along the way, everything you've learned. And I think that's so special.
Thank you.
And really speaks volumes to the importance of sharing your story because everybody's journey looks different, but a large connecting thread is lack of control, feeling unprepared, and ultimately just not understanding our body.
Yep.
All right. Well, I think one thing that I just want to say is that we ask everybody, you know, what's one key to your health that you would recommend, you wish you had known younger, or you would tell to anybody who might be listening? What's one piece of advice you might give to people?
I would just say consistency.
Oh, I love it.
That's one thing that my husband and I really strive for. We always say, be consistently good over occasionally great. And we use that in everything. For us, you know, we prioritize health, wellness, taking care of ourselves, and really fueling our bodies and teaching our kids now the same thing. But that being said, we still love to go enjoy a pizza and margaritas and live our life. But what we try to do is just be consistently good. So we have the time and the flexibility to go have fun and live life. And I feel like that mental freedom and peace that comes from that, however 20% that people say where you go live your life, like that in turn has made me an overall healthier human.
Yeah.
So I think consistency is the biggest thing. I think people try too hard to make major changes and then they fall off the wagon. But for me, it's just a little less stress and just show up a little bit every day and chip away. And I think that's when we've seen the success, and we've really reached our healthiest selves by doing that.
I love that. I say something very similar, right? If you treat your body kindly on most of the days, then it allows your body to tolerate the fun things, the pizza, the beer, the ice cream, because it can recover and heal from that little, burden a lot easier than if you're not treating yourself kindly all the time. So it's not about perfection. We don't have to be all or nothing. But I really love that consistency advice. Yeah. And I think your story really speaks to the truth of testing, right? So early testing is never wrong, being an advocate for yourself, and that trusting those gut feelings, right? Even when a doctor or the world or somebody says, nope, just keep trying, everything's fine. If you have that feeling, you can always get tested sooner. You can always get more information. People deserve information about their bodies.
Absolutely.
Steph, thank you so much for being here. Do you want to tell everybody where they can follow you online and where they can learn more about you?
Yes, for sure. My Instagram is just Stefany Bare. I have lots of recipes for toddlers and families and lots of fun stuff like that. My goal is to help fuel families in happy ways and in food ways and all of the ways. So, and thank you for giving me my first child, because I've said that a million times, but I look at her and I'm like, I can't imagine if I had another child. Like the timing of things just works out so beautifully. Yeah. So thank you.
Oh, you're going to make me cry. Well, thanks to everybody watching. Take away that you're not alone. You deserve to advocate for yourself. You deserve to understand your body. And Steph's story is just such an important reminder that nobody's going to really look out for you like you will, and that you're never wrong to prioritize yourself and to seek more information. Thank you guys so much for listening this week. Steph, thank you so much for being here. And until next week, thank you, friends. Thank you for listening to the As a Woman podcast. If you're ready to take control of your reproductive health, my new book, The Fertility Formula, is your next step. It's a science-backed guide to understanding your hormones, optimizing your fertility, and owning your reproductive future. You can order your copy and learn more at nataliecrawfordmd.com/book. And as always, follow along at Natalie Crawford MD for even more support. Because knowledge is power, and your health deserves a formula made just for you as a woman.